the fascia continues to run the outside, but then, like if there's the interosseous membrane, you have the tibia and the fibula, and there's the interosseous membrane here. And we'll talk more about the anterior compartment because it's more enclosed in fascia and then there's bone and harder membranes. But in the back part here, on the calf muscles, there's not a tight band of fascia around the front. So we're not really going to get into compartment syndromes as a type of injury, but you can have what's called anterior compartment syndrome. And that's because this area here, most of it is the bones and the interosseous membrane, and then you have a little bit of the muscle that's exposed out to the surface, and that can tend to get tightened up if you have swelling. It doesn't have anywhere to give, and it can put pressure on the muscles, on the nerves and the vascular structures. Whereas in the backside, there's much more open area, so there's room for swelling to expand to, but you have anterior compartment syndrome. But you can understand a little bit more about the compartments as we go along. All right, so then we talked about movements of the knee. Now we're going to be talking about movements of the ankle foot. Because just in the hand, it's the same as it was in the forearm. Most of the forearm muscles are going to do movements distally at the hand and wrist and finger. So it's the same thing in the lower leg. Most of these muscles, there's some that, like the gastroc, that do go across two joints, but most of them we're talking about actions that occur at the ankle and the foot. So we'll talk about dorsiflexion and plantar flexion. Okay. Plantar flexion is like this. If this was the foot, I can show that. This is plantar flexion, and then this is dorsiflexion. Okay, because it gets a little, to keep it from being confusing, if we just say flexion of the foot or flexion of the ankle versus extension, it's easier to specify where you talk about plantar flexion and dorsiflexion. But technically, if you wanted to say which is flexion of the foot or the ankle, this movement, plantar flexion, or dorsiflexion? The way the easiest way to remember it, yeah, this is plantar flexion. The way the easiest to remember it is what's flexion of the toes. Let's say if this was my foot, what's flexion of the toes? Like this. Okay? So this is flexion of the toes. So this would really be true if you had to say which one's flexion and which one's extension. That's flexion of the ankle and the foot. This is extension. But to clarify it, what we say is this is plantar flexion and this is dorsiflexion. But the way to remember it is to look at what happens at the foot, on the toes. Okay? Obviously, you know that when you curl your toes, that's toe flexion. So the same movement, the muscles that do those same movements are going to be flexion of the ankle foot. But to make it more clarified, most of the time we're talking about plantar flexion. Okay? But when you talk about muscles in the lower leg, so all these ones on the back here are going to be flexors, right? Or plantar flexors, but those are going to be flexors, and then these are going to be extensors. So if you talk about extensor digitorum longus, extensor hallucis longus, those are the ones that are going to be here, versus flexors are going to be on the posterior part. And so what movements occur at which joints? At the ankle, you can have dorsiflexion, plantar flexion and dorsiflexion. And then to get more into inversion and eversion, that doesn't really happen so much at this actual ankle mortise joint. That's going to get more into the tarsals. So inversion and eversion occurs more into the intertarsal joints. And then, like I was saying, with the toes, you're going to have flexion and extension. So now you divide them into the different compartments. So you have the anterior compartment, which is going to be here. Right? So then what action did we say that's going to do? At the toes, is that going to be flexion or extension? Plantar flexion, dorsiflexion. It's going to be extension or dorsiflexion. Okay. So that's going to include tibialis anterior, extensor digitorum longus, extensor hallucis longus, and fibularis tertius. If you studied anatomy years ago, like I did, we used to call it peroneus tertius. But now they call it fibularis tertius. the main ones are these other ones. This fibularis tertius is kind of a minor muscle. The most main are going to be tibialis anterior, extensor digitorum longus, extensor hallucis longus. And so they're going from superficial to deep. Here you have the tibialis anterior, and then you can see here that's going to the toes, so that's extensor digitorum longus. And then the one goes to the big toe, it's going to be extensor hallucis longus. And this you can see it's going to be coming in deeper. That's going to be coming off of the fibula and probably some of the interosseous membrane. And then this digitorum is going to be higher up. But we'll go through the specific origin insertions in a little bit. All right, so now we'll talk about the tibialis anterior. Let's see, does anybody have some of the muscles that they're going to do? Does anybody have any in the anterior compartment?
I have the tibialis anterior.
Okay, come on down.
What's the digitorum? Are you ready to do that?
That's on the other side.
Oh.
And the extensor. Okay. So then, extensor digitorum longus. Now we're getting into this one here. So that's going to be. There is another muscle that it's on your list for your palpation landmarks, I believe. The part of the extensor digitorum longus that goes to the little toe is going to be extensor digiti minimi. Right? That's not like Mimi in the. Yeah. Because in some of the anatomy textbooks, when they talk about point location, they're going to say extensor digiti minimi. But that's what this is. It's just the last tendon of extensor digitorum longus that goes to the little toe.
It is marked
Yeah. So that's why we have it on there, is because some of the point location books are going to mention that specifically. Because when I was looking it up, I'm like, well, I never heard of that. What's that? So then finally I found out, yeah, it's just the last tendon there. So the origin is going to be lateral tibial condyle up here, and then also off of the fibula and the interosseous membrane. Because when you're talking about muscles that are more, like I said before, the ones that are more superficial tend to be just off of the bones themselves. And then once you get into the deeper parts, then you're talking about the two different bones and then part of the interosseous membrane. And there's going to be some variations depending on what book you look at, whether it be this textbook or the Trail Guide. And then it's going to be tending into the middle and distal phalanges of the second through the fifth. And then obviously the action is going to be extension of the toes and then also dorsiflexion of the ankle. Then you have extensor hallucis longus. So that's going to be more distal along the lower leg, and it's going to be more onto the actual fibula itself. Some sources they may say that it's off of that interosseous membrane as well. Right? And that's going to go into the big toe, distal phalanx of the great toe. So it's going to extend the great toe and then also dorsiflex the foot. And it's also going to work together to dorsiflex the foot with the tibialis anterior and extensor digitorum longus. Then we're getting way down deep into here, and then we have this little peroneus tertius or fibularis tertius. So sometimes it's considered a fifth tendon of the extensor digitorum longus. You may or may not be there. It's going to go on to the distal anterior fibula and the interosseous membrane. It's going to be more distal than the other muscles we talked about. It's going to go on to the dorsum of the fifth metatarsal, so on this area here. And then it's going to do eversion and plantar flexion of the foot. Okay, so the one muscle we talked about in the anterior compartment that does inversion is the tibialis anterior, and that's more on this side. And then this peroneus tertius, if it's here, it's going to do eversion.